So maybe we'll get started and they will just join during the presentation. So thank you very much, everyone, to be here for this webinar with Dr. Emmanuelle van Erck. So we'll be talking about heart murmur and their consequences on your horse's career. So just about logistics, if you want to ask some questions during the presentation, you can use the chat, so you should be able to see it on the right corner of your screen, and make sure you write to everyone so that Emmanuelle and I can see your questions and we'll answer them at the end of the webinar. So let me introduce myself. My name is Gabrielle and I work at Arioneo, and I'm in charge of producing some resource and content about equine physiology, such as this webinar. And I'm just going to let Dr. Emmanuelle van Erck present herself.
Good morning, everyone, or good evening, depending on where you are. I'm Dr. van Erck. I am a equine veterinarian specialized in internal and sports medicine, and I practice from Belgium, but we see horses all over the place.
So before we started, I just wanted to present you Equimeter, which is an all-in-one equine fitness tracker that we developed at Arioneo. So you can see it on the left side of my screen. This tracker collects heart, GPS, and locomotion data, and from which it computes more than 250 parameters about equine physiology and locomotion. And you can see all of this data on a very user-friendly platform. As you can see, I've put some screenshots on the right side of my screen. And this tracker uses very scientific and accurate electrodes that have been patented, and it collects automatically the ECG during exercise. And so all of the ECG you'll see during this presentation have been recorded with this tool. And so regarding of today's agenda, we will start by defining the scope of our discussion. So we'll talk about the athletic horses' health management and performance. And so we'll present the data and how can data really embody the health dashboard of your horses. Then we'll move on to the main topic of today, which is heart murmur definition, and we'll explain how you can detect one. And finally, we'll end the discussion with 2 practical cases, and we'll try to assess what is the impact of a heart murmur on a racehorse performance and health. So Emmanuelle, I let you start the presentation.
Thank you very much, Gabrielle. Well, if we're all here today is because we're passionate about horses, and that is probably because they're amazing athletes. And one of the features that explains their incredible athleticity is the fact that they have huge hearts that power their exercise. So next slide.
Yeah.
If you use heart rate monitors or systems that allow you to follow both speed and physiological data like the Equimeter, you can determine at what rate the horse's heart is beating at any time during an effort. This helps you to assess the level of exercise that the horse is doing, and also to determine if the heart rate is normal or if the horse is in overdrive. That means that the horse is straining to maintain his effort and has abnormally high heart rates. So next slide.
Yeah.
So the topic of our discussion today is heart murmurs, and heart murmurs are additional noises that will be heard over the heart. So the heart is constituted of 4 cavities, 4 sets of valves that allow the blood to flow in a certain direction and never go backwards. There are large vessels as well. Heart murmurs are defined as noises that can be heard in addition to the usual lub-dub sounds that you would hear when you auscultate a heart. So they can correspond to changes in the turbulence of the blood flow, and they can be either physiological, that means normal, or they can be abnormal murmurs that can, for instance, be caused by some of the valves that don't close properly and are going to leak blood backwards. That's what we call regurgitation. So these abnormal murmurs are important to detect because they can affect the way that the heart is going to function. If we just go back one slide, Gabrielle.
Yeah.
To be able to detect the heart murmurs, you need a stethoscope. So you need to be able to listen to what's going on when the heart is beating. And because horses' hearts are very large, the veterinarians will take some time to listen to all the different areas of the heart, both on the left side and on the right side. And if we have any indication of an abnormal heart murmur, then we will do some additional investigations, one of which can be an echocardiography, where we're going to image the heart and see if the shape is normal, if the valves are leaking or not, and what degree of leaking we have. And then we can also look at it functionally. That means equip the horse with a heart rate meter and see how it behaves during exercise. So next slide. This is an example of an echocardiography. So it's an image of the heart that you can have dynamically. So if we had this as a video, you would see the heart beating. And we've placed a little window of Doppler over the mitral valve. And you can see on the image on the right, you've got some green coming backwards into the atria. That is that mitral valve is not closing properly, and there is a backward flow of a certain volume of blood. So the cavity in which the flow goes backwards not only has to contain the normal blood volume, but that extra volume from the regurgitation. And the idea is to assess if the heart is capable of coping with that, yes or no. So next slide. So what do we do when we have a heart murmur and we want to know if the horse is tolerating it? When we can look at it from a training perspective. Let's see what the horse is doing during work. Some indications that the horse might have an underlying problem would be that the horse has a decrease in his tolerance to exercise or a decrease in his performance. It could be a horse that recovers less well after a regular work, a horse that over time fails to show progress, whereas the other horses of the same age or same category would be improving, or it could be a horse that has an abnormal heart rate either at peak exercise or during recovery. Another thing that we're going to look out for is arrhythmias, because if the heart is filling up with too much volume too early in its cycle, it's going to want to empty prematurely, and that can cause arrhythmias. So next slide. We wanted to share with you two examples that we've had of horses with heart murmurs. So the first horse was I think it was a 3-year-old. It showed a lack of progress and was not performing to expectation during races. So the trainer called for a vet check, and a heart murmur was heard in an area that is possibly abnormal. So we had a look at the corresponding equimeter data from that horse, and you can see on the graph on the right, you've got a square there that highlights the recovery of that horse. That horse, after a breeze, had a heart rate that stayed at 125 beats per minute, although he was walking back to the stables. So that's a very high recovery heart rate, and it took him a long time to recover. So that warranted for additional examinations to see if there was an underlying cardiac issue that would explain this prolonged recovery. The next slide. Here we look at the ECG of that horse during his exercise, and you can see that the spikes that you have on the lower graph indicates episodes of arrhythmia, and this horse had premature beats during his maximal speed, and that of course completely disrupts the horse's circulation, reduces the perfusion of oxygen to the muscles. So that is a problem for the horse. That horse has an abnormal cardiac response to exercise. Next slide. Now we did an examination of that horse and determined on echocardiography that the heart murmur that the veterinarian had picked up corresponded to a pathological regurgitation of the valve. That means that the horse was not tolerating that leakage of the valve and was really swollen. And unfortunately, we cannot do much about that. But this horse's career was then interrupted. He was reformed and no longer participated in races, which saved the trainer from continuing to train a horse that would not have progressed and would have had repeated poor performances. Next slide. So this first case shows how you can evaluate the impact of the heart murmur and the underlying cause of the heart murmur on the horse's tolerance to exercise. Now we have another example. This is a mare that had a slight decrease of performance, and over time you could see that she was not recovering appropriately after regular training, but certainly not to the same level of the previous horse. So she took a little bit of a longer time to recover, but here, if you look at the data, she's at 109. Remember, the previous horse was at 125. Like the previous horse, a heart murmur was heard during her examination. So we wanted to check if her data was abnormal or not. And really what we saw is that she had a normal ECG during exercise, and her values corresponded to the same group of horses of the same age and same level of training. So here, this indicates that her cardiac response to exercise is normal, and her the cause of poor performance is to be found elsewhere. And so instead of focusing on the heart and doing an echocardiography, the analysis of the data shows that the heart murmur is benign, and we need to look elsewhere for the poor performance. Other potential factors could be investigated. So really, as veterinarians, it's very valuable for us to have tools such as the equimeter, because the data is recorded automatically during training. And if ever you can see an abnormal response to work, if the horse feels a little bit off, if the horse takes a longer time to recover, if the horse has a lack of progress in comparison to the other horses, this can be really objectively assessed with a system like the equimeter. The data is automatically uploaded to a platform, and we can have access to it, review the data, review the heart rate values, review the recovery, review the ECG, and determine if there is a disease or a disorder that could explain the horse's behavior, and investigate by doing some additional workups or examinations like an echocardiography in the instance of a heart murmur. So it really brings all the information on the horse's health together, both our normal examination at rest, but also how the horse functions and responds to an exertion. Is it normal or abnormal?
So yes, I think that was it for the presentation. We hope you like it. And now is the time for the questions. If you have some, you can use the chat. I'm just going to stop to share my screen, and so I'll be able to see your questions. Just make sure you write to everyone so I can see your questions.
Heart murmurs are something that we hear frequently, and I know that in our practice we have during, for instance, pre-purchase examinations. A lot of the vets that are worried that, you know, the heart murmur is compatible or not with exercise. And so we will systematically do a little exercise test to see how the heart rate changes and if there are arrhythmias or not. That's really important. And often the horses tolerate it well, but sometimes when it's not the case, it's really important to know, because it will affect the horse's long-term career.
Yeah, so we have one question, Emmanuelle. So it's from Camilla. Thank you, that was very interesting. Have you applied it to eventers?
Yes, definitely. And I think that that is very important, because eventers are horses that are a little bit older, and naturally they have very large athletic hearts that have been remodeled by training. And so they're a population of horses where we often encounter murmurs. So it's very important to assess that. And the equimeter works great with the eventers.
So we have another one from Jonathan. What may be the other causes of benign murmurs?
So the heart is a very large organ, and you can hear the turbulences of the blood flow because you have a huge pump filled with a volume of fluid that is going to pump blood through vessels that are a little bit narrower and that are elastic. So it's really that vroom, turbulence that you can hear and that can generate normal murmurs, what we call flow murmurs. So it's the normal blood flow in an athletic heart that you can hear.
Okay, and then we had another one from Charlotte, but I think it's quite the same. You've answered it. It was, could you explain in a little more detail how a heart murmur could be benign? But you just answered it. We have another one. Could we imagine to implement this tool to prevent injuries for the racing organization?
Definitely. That's really the aim, because right now, veterinarians are called when there is a problem after a competition or after a work. Whereas here, if we monitor the horse on a regular basis during training, we're much more sensitive in detecting smaller things that would happen prior to a competition. And we've had this example regularly where we see that the horse's response to exercise is not normal, and either, you know, it's a respiratory disease, and you know that the horse is not breathing properly, so you can treat the horse and you avoid having horses that have, I don't know, exercise-induced pulmonary hemorrhage or bleeding from the lungs. But we've seen it also in horses with tendinitis or even fractures. There are things happening in the run-up to the accident or the incident that really is a problem for the horse. So this is a great preventative tool, and I hope it'll be adopted much more broadly.
Yeah, so we have one more. When thoroughbreds pull up post-race with arrhythmias, then after rest show nothing, what is most likely the cause?
It can be lots of things. That's the advantage of looking at horses at higher speeds, because you're much more complete in your examination. The high speeds and the high workload is exactly where the problems are going to occur. And if you auscultate a horse post-race, sometimes you're going to miss some of the things. It can be underlying cardiac problems, like we've just talked about, regurgitations, but it could be also some arrhythmias are caused by lack of oxygen. So horses with upper airway obstruction, displacement of the soft palate, or horses with acute pain during work can also show arrhythmias.
Yes, thank you. Then we have, often you can hear a murmur with a horse with a strong colic. What is the reason and how serious is this?
So that's really important to know that horses with a colic can have murmurs because they're dehydrated, and so you're going to change the sound of the flow of blood within the heart because of that dehydration. There's also a factor of pain, and that changes the way that the heart functions. So it is important to re-auscultate the horse after the colic and see if you still have the murmur or not. Some of the colics are caused by ruptures of the valves or abnormal heart issues. So it's very important to do that sequential auscultation before and after the colic to see if it's a heart problem that generated the colic or if it's really just a digestive tract issue, and then the heart murmur will disappear after the episode of colic.
Okay, then we have one regarding the second case. So had the second filly a murmur of the previous case or from the first case, or was it something else?
So she had, if you want the technical terms, both horses had a systolic murmur. That means that at the moment when the heart is contracting, the ventricles are contracting, you can hear a murmur. And normally, if you're an experienced vet, just by changing the position of your stethoscope, you can hear where the point of maximal intensity is located. And in the second little filly, it was located more towards the base of the heart, which corresponds more to a flow murmur, a normal flow murmur, whereas the other horse, it corresponded more to a mitral valve murmur. But she could really have had a mitral murmur as well. But some horses tolerate it really well and can do an absolutely normal career, even though there is this underlying valvular regurgitation. The idea is just to see if the heart tolerates it, both at rest and during exercise.
Okay, then we have, can you identify horses with bigger hearts?
You can. So you can by looking at the heart rate. Horses with very large hearts usually have lower heart rates because the heart contains a huge volume of blood and does not need to beat as quickly to circulate the blood. That's one of the ways to do it, but also by echocardiography. So by doing that image of the heart with an ultrasound machine, you can see and measure the dimensions of your cardiac cavities.
And so the last question we have, with the second case study, what was the protocol followed to get the mare back to full work and continue to improve?
So that mare actually had a little respiratory infection, and she was treated for that. So there were respiratory samples that were taken because on auscultation of her airways, you could hear that there was mucus in her airways that was sampled, processed at the lab, and a bacteria was isolated and she was treated accordingly. And then we could monitor her return to work and saw that she really went back to a level that was comparable to the other horses of the same age.
Okay, well, that was a lot of questions, but no, thank you from New Zealand.
Hey, New Zealand!
Okay.
That's great.
Yeah, if you have any more questions, feel free to ask them. Otherwise, I think this will put this meeting to an end. Anyway, we will send you the records of this webinar, and we will also write the questions and answer you had. We had one other, no. Aaron is. Yeah. So thank you very much for your presence, and we hope you like the presentation, and I think this is it. Thank you very much, Emmanuelle, for being here and presenting about heart murmurs, and I wish you everyone a good day or a good night, depending on where you are. Yeah.
Have a good time. Thanks for being here. Bye.
Bye.